I am asked so often by postmenopausal women, do I still need to look after myself? Everything's over. I feel fine now. Do I still need to keep on with my supplements? And the answer is a huge yes. Post-menopause, some conditions such as cardiovascular disease and osteoporosis can become more prevalent, and these can have a huge impact on your health as you go into old age. So today I'm going to look at why these can be impacted even at the beginning of the perimenopause and what you need to do, and also how you can protect yourself in these situations. So according to the British Heart Foundation, estrogen has a protective effect on the heart. It controls cholesterol. It reduces the risk of fat building up in the arteries, and it helps to keep your blood vessels healthy. So when your estrogen starts to fall, so this is going to start in the perimenopause, fat build up, stress on the heart, blood vessels can narrow. So all of these things can have an impact on your future heart health. So what we want to look at here is what you can do to start protecting yourself as early as possible, so that by the time you get to postmenopause, you don't need to worry so much about these things. So with the heart, a huge amount is healthy lifestyle, diet. Stress has a huge impact on heart health. So you need to look at what you're eating. So that would be things like a Mediterranean diet is a really good one. It has loads of sort of vegetables, healthy fats, oily fish, small amounts of whole grain and meat and dairy. You need to look at to reduce salt intake. So that covers a lot of your processed foods, sugar intake as well. And also just to make sure that you're getting a varied diet, so that you're getting lots of everything, so that your body gets everything it needs. You need to look at protecting yourself against high blood pressure. Now, high blood pressure is called the silent disease because very often there are no symptoms until you get that heart attack. So it's really important here, again, keep your stress levels down, look after your diet. I would recommend maybe once every 6 months getting your blood pressure checked professionally. Please don't go with these home kits unless you have been prescribed to do so by your healthcare professional. The reason being is that you can become obsessive about it and you can end up testing yourself every week, which is not going to do your stress levels any good at all. So maybe once every 6 months. Here in the UK, most pharmacies will offer blood pressure testing. So that's certainly one way that you can go here. You need to keep active. Your heart is also a muscle, and you need to keep that working hard to keep the muscle function in the heart healthy. So it's about keeping active every single day, doing something, getting your heart rate up that little bit. And it doesn't need to, you don't need to be pounding the streets and going down the gym for an hour at a time and then feeling utterly exhausted. Huge research coming out now looking at how you can just exercise hard for 7 or 8 minutes a day, and that's it, and that's going to be enough to really support heart health. So it doesn't need to be manic at all. I don't do that. I just do very short, sharp exercises on a daily basis just to get my heartbeat going up that little bit, and that's it. And it certainly worked well for me. Remember to have rest, relaxation, and also things like yoga, Tai Chi, and Pilates and Qigong, just to help with the flexibility aspect as well. You can look at herbs such as hawthorn and garlic. Hawthorn is known to help support heart function, and garlic, it's well known to help to keep the arteries clear and to stop that kind of fatty build-up happening. Second one is looking at your bones. And again, estrogen is really important for bone health. So estrogen keeps your bones strong. It keeps the buildup of calcium in the bones, and it helps to keep bone density normal as well. So again, when your estrogen starts to fluctuate and fall in the perimenopause, this is where you need to start looking after your bones. Here in the UK, the number of women who end up with hip fractures post-menopause, it's absolutely huge. And a lot of it is just due to lack of supporting bone health way back in the perimenopause. So again, you're looking at falling estrogen can affect the density of the bones. It can make them more fragile, which means that you can get fractures much more easily. So things to help to keep your bones healthy. You're looking at calcium and magnesium rich foods. These two need to go together because magnesium, it's like the bus that takes calcium to the bones. So calcium needs transport to get to the bones, and magnesium is one of the good ways of doing that. So you're looking at having a diet that's rich in magnesium and calcium foods. Just Google, get a list of all the foods that have both of these in, and just start introducing them into your diet. Vitamin D is also vital for bone health. If you are like me, I'm in Scotland and we have not had a lot of sun this year. So that's going to impact on the production of vitamin D in your skin getting out into the sunlight. So it's really important. I take a low dose vitamin D supplement every single day of the year just to make sure that I'm getting enough. It's a difficult one to get in your diet. Dairy products have vitamin D in them, but dairy products are low in magnesium, so you're getting a bit of a hit and miss with dairy products. Mushrooms apparently are high in vitamin D, and I found some in supermarkets that actually say rich in vitamin D. So that's something that you can add to your diet. You can look at certain supplements. So we have the Balance Perimenopause Mineral Drink, which contains calcium, magnesium, and vitamin D. And these are all known to support good bone health. And that can be taken, even though it says perimenopause on it, you can take it right through the menopause and post-menopause as well. Again, keeping active, you need good weight-bearing exercises that encourages the bones to stay strong. So that's things like your walking, aerobic exercise, dancing is it's a lovely one if you enjoy dancing, to keep your bones strong and healthy. So these are all easy things that you can do just to prevent anything happening post-menopause. Important thing to bear in mind, we know that HRT protects the bones, protects the heart. But if you're on HRT, that doesn't mean to say that you can just forget about looking after yourself, because there are many women who for some reason or another have to stop their HRT at some point. So you want to maintain your health even though you're getting the added benefits of the HRT. For those of you that can't take HRT or don't wish to take HRT, then just looking after yourself, doing these things that I've mentioned, can certainly see you into a happy post-menopause. So I hope you found this helpful. Have you done anything to protect your bones and your heart? What have you done? Please share your stories. You know I love to read them, and some of your tips are so helpful, and they're going towards helping other people too. So have a lovely week, and I'll see you soon.